Ever wondered what alpha-thalassemia is and how it affects the human body? Well, let's find the answer to this mystery together. Alpha-thalassemia is a blood disorder that significantly reduces the production of hemoglobin, the iron-rich protein in red blood cells. This protein is of great importance as it carries life-giving oxygen to cells throughout the body. When you think about it, hemoglobin is like a fleet of delivery trucks, constantly supplying cells with the oxygen they need to function efficiently. However, in the case of alpha-thalassemia, this fleet is drastically reduced. This means fewer trucks on the road and less oxygen reaching the cells. And just like a city would struggle to function if its deliveries were cut short, your body faces similar challenges when hemoglobin production is affected. This, in essence, is what alpha-thalassemia is all about, a disruption in the body's oxygen supply chain. Now that we've established what alpha-thalassemia is, let's delve into its causes. What causes alpha-thalassemia, you may ask? Well, we're delving into the realm of genetics for this one. Alpha-thalassemia is a genetic disorder that occurs when there are mutations in two specific genes, HbA1 and HbA2. These genes are like the blueprints that our bodies use to manufacture alpha-globin, a key component of hemoglobin, which our red blood cells need to carry oxygen efficiently. When these genes are mutated, our bodies can't make enough alpha-globin, causing an imbalance that leads to alpha-thalassemia. Now here's the thing about genetics, they're hereditary. That means alpha-thalassemia is not a condition you can catch like a cold. It's something that's passed down from parents to their children through their genes. So if both parents are carriers of the mutated gene, there's a chance their child will inherit alpha-thalassemia. Understanding the causes is important, but recognizing the symptoms is equally crucial. What signs should you look out for to identify alpha-thalassemia? This is a crucial question as the symptoms can sometimes be subtle yet significant. One might experience fatigue or weakness. You know, that feeling when even a short walk feels like you've run a marathon? That could be a sign. Or perhaps your skin has a pale or yellowish hue, not quite its usual healthy color. Facial bone deformities might also occur, subtly altering your features. Growth in children may be slower than expected, and abdominal swelling could become apparent. Don't disregard dark urine either. While it can result from something as simple as dehydration, it can also be a symptom of alpha-thalassemia. These are just a few of the common signs. The symptoms can vary greatly from person to person, and sometimes they may not even present until later in life. Early detection is key, so if you exhibit any of these symptoms, reach out to your healthcare provider. What can be done if you or someone you know has alpha-thalassemia? Well, the treatment of alpha-thalassemia revolves around managing the symptoms and improving the patient's quality of life. There are several treatment options available depending on the severity of the condition. One common treatment is blood transfusions. This procedure replenishes the blood's hemoglobin, allowing it to carry more oxygen. However, frequent blood transfusions can lead to an excess of iron in the body. This is where iron chelation therapy comes in. It's a treatment that helps to remove this surplus iron, preventing it from causing harm. In severe cases of alpha-thalassemia, a bone marrow transplant might be considered. This procedure replaces the patient's bone marrow with healthy marrow from a donor, essentially resetting the body's ability to produce healthy red blood cells. Regardless of the treatment path, it's crucial for patients to have regular medical follow-ups to monitor their condition. While alpha-thalassemia can be a challenging condition, proper treatment can manage the symptoms effectively. Let's recap what we've learned about alpha-thalassemia. It is a blood disorder that reduces the production of hemoglobin, the protein in red blood cells responsible for transporting oxygen around the body. This condition is caused by deletions or mutations in the genes responsible for the alpha chains of hemoglobin. The number of gene deletions determines the severity of alpha-thalassemia, which can range from being symptomless to causing serious health problems. Symptoms can vary, but common ones include fatigue, weakness, and shortness of breath. More severe forms may lead to abnormal facial features, slow growth, and jaundice. Treatment options for alpha-thalassemia primarily aim to manage symptoms and depend on the severity of the condition. They can range from regular blood transfusions to stem cell transplants. Remember, knowledge is power. The more you know about conditions like alpha-thalassemia, the better equipped you are to understand them. Stay informed, stay healthy.